talk and speak tonight. So I have a couple of roles here at Total Health Guidance. I'm a life coach, certified health coach, and a licensed massage therapist. How that comes into play with our office, if you look at the next slide, it talks a little bit about, we look at whole person health. Next slide, please. So we're looking at the whole person when you come in, so mind, body, spirit. And what I'm looking at in regards to any pain is there's always a tie-in with everything else that's going on in someone's life. It can be emotionally, relationally, any of those things. So we always look at the body and massage connected with everything. Our mind, body, spirit, they're not separate. So mind, how chronic pain can affect the mind and emotions. Dr. Bowen referred to that a little bit earlier as well, so I'll just go ahead and move past to the next slide. For me, I have had issues with chronic pain before, and for me, it's just this constant tick, 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 tick in the back of my head where I can't get any relief. Kind of that's my analogy for it. It just kind of is always there, and it's pressing, 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 and at some point, boom, it's going to come out. We have to make sure we take care of ourselves. And that emotion, it can come out emotionally, relationally, spiritually, and financially. So often people think about massage and they just think it's physical. But if your physical self is in pain, it is going to affect all of those things. Your emotion, your relational connections, probably your spirituality, your financial state as well, if you're needing to seek a lot of different treatment. Okay, so next slide. Great, so we're going to talk about the wheel now. The wheel is basically, we want to keep our life balanced. If a spoke in the wheel is broken, bent, or not in place, the wheel will not work right. So again, when I'm looking at a massage client, I'm asking all these questions about their physical, emotional, relational, spiritual, and financial health to help understand what they're dealing with emotionally, internally, outside of the physical, to help support them in their treatment. So physically, pain and fatigue, emotional, you're dealing with anger and other emotions. Relationally, it might be a strained relationship because of responses to pain. Spiritually, they may be fatigued and they're not engaging in their spiritual practices. And then financially, the cost of treatments and medicines can be quite extensive as well. So next slide. Okay. So what we want to do, we want to feel young again, right? We want to kind of have that joy and the energy and laughter that chronic pain can often take away from us. So we have to remind ourselves, that we might not be able to be a kid anymore, but we can certainly be a kid at heart and improve our lives and our condition, our life, basically, and status of living. So next slide, please. So we're going to talk a little bit about massage and how it helps. So again, massage helps relieve pain. It also reduces muscle stiffness. So that pain, when it's relieved, it relieves the muscles in the surrounding joints, relaxing them, releasing stiffness, and allowing for better range of motion and mobility, allowing people to do their activities and create an environment where they can be physical where they might not have been able to if they're just dealing with their chronic illness in another way. A massage also helps circulation, and it helps reduce inflammation. That enhanced blood flow to the arthritic joints can improve movement and again reduce pain. So, these things lead to an increased relaxation, decreased stress, and a sense of well-being that Dr. Bowen also referred to, and it makes it easier to keep their wheel balanced, right? Next slide. So there are a number of different types of massage, and they're not all super physical. They're not all rough and deep tissue. For someone that's dealing with any type of arthritic or chronic pain, we have to really look at how we apply the massage to them. And there are some very low impact massage offerings that we do for them. So Swedish is a very light massage. There's not a whole lot of deep tissue going on. It's a very basic massage. We're covering all over the general body and just kind of making sure the person is feeling very relaxed. It's very slow and methodical. Lymphatic massage is a very slow massage where we're focusing on very light brushes with either a brush or with strokes to help activate the lymphatic system, to help clean out toxins in the body and to drain it. So this is also another one of those feel-good massages where after the fact, once you start feeling the results of it as your system is cleaning itself out. So that's really good for it as well, for arthritis as well. So essential oils is something that's really good and can be applied topically to the affected joints and to the areas around it to help make them feel better. And for me, it's always a natural option as opposed to medicine. I think there are a lot of adverse effects that medicine can have. Obviously, some of us do need to be on medicine, so this can be an enhancement for your treatment, maybe reducing medicine. It really depends, but there are some definite avenues where you can, look at ways to replace. And essential oils is a big way to do that, and it's so good, works really well, and also smells amazing. There's also something rocking and friction were a little bit more physical, but that was more of a massage just to kind of bring your energy down, to relax you. It's not a whole lot of body touch. It's just moving the body back and forth. So we kind of sort of swaddle the client and then rock them and just kind of give that attention and that love and energy to them. Friction massage is also something we do. That's good for in like loosening the tissue, improving blood flow. We would obviously only do that when indicated. If it's acute and there's pain present, we would definitely not do a friction unless there was just some minor situation around the joint. We could do it a rub above and below the joint, but we wouldn't really act on the joint with friction unless there was no pain present or very minimal pain based on what the client can handle. So the other thing that we talked about is, again, the body is not disconnected from the mind and spirit. It's all one. It's self-contained. So my emotional status, when I was dealing through my chronic issues at a really bad state, was definitely affecting my emotional self was definitely being affected by the pain. So I do a specific massage here called emotional release. It is also known as somatic massage that focuses on addressing the emotions in the physical body. So you probably have all heard about body muscle memory, which often is referred to people that work out or play sports. So it's sort of a similar concept, the idea that your brain, your emotions can be held in places in the body, and massage and helping to figure out what those are and give language to them can help release them in the body. So that is more of a massage with guided meditation to help the client work through the mental health portion. And what happens with us is when I'm done with that client, they go right into a counseling session to help really elevate and kind of clean all of that up. So it's really a great experience to be working on the body, but affecting the emotion and spirit as well. So next slide. If you're suffering from chronic illness, of course, we're all looking for new things. We get frustrated, like what to do. What is the next step? So we're going to talk about, on the next slide, we'll talk about some ways to kind of handle creating some natural options for you. So the next slide for me. So as I mentioned earlier, lavender or different types of essential oils can help. Nutrition, we're always looking at food as health. And we want to make sure that we're eating as much natural food as we can. So with massage therapists in my training, not only do I do the body and massage, I do physiology. We learned some acupuncture as well, but we are really focused on nutrition because we're also looking at the skin and all these things that are affected by the food that we consume. So we are a little bit broader scope than I think a lot of people believe or know when they think about massage therapy. We really do involve a lot. So nutrition is always an important factor, and it certainly is important in our practice here. And then massage, of course, acupuncture. And then to address the mental health issues that can come, the frustration, the anxiety, the anger, all of the things, the depression that can come from that, counseling is also something that would be really important to look at for anybody that's dealing with chronic fatigue, and is it managing it well? So the next slide. To answer the question, what do we do? We want to find balance. We want to make sure that we're touching on all the areas of our wheel to make sure that it's working properly so we can move and we can function in our day-to-day and be healthy. So some things you can do, some very basic things to help find balance is improve your diet. So you really want to look at eating more clean foods. You want to look at, more fruits and veggies, organic when possible. And if possible, we want to focus on finding a movement exercise that works. That would be a low impact exercise like yoga, Tai Chi, stretching, or walking. So increasing your self-care practices, which would include improving your diet and exercise. The idea is to take time to feed yourself. So maybe some hobbies that you aren't into and kind of get into those again, volunteering or take some classes. You can find someone to share your experiences with as well, because when we're in that space of just us dealing with our pain, we often don't share with other people, and the release of it is very important. My theory is better out than in. So sharing it with friends, family, a support group, or seeking professional care if you really need to get some support around the mental and emotional aspects of your pain and managing your pain. So of course, pain management, I like to think of it as a natural source. And what we want to do with that is just be proactive. Essential oil, massage, and I think about massage and acupuncture as a maintenance for me. I go every month without fail, at least once, sometimes twice, to make sure that I'm kind of proactively getting my body and keeping my body healthy so I won't deal with the onslaught of pain when things get out of whack. It can really help maintain. So instead of reacting to the pain, we're kind of working ahead of time before the pain comes and kind of making sure that we can take care of ourselves before then. And obviously the last one is have fun. No matter what, it is super important to have fun. Find the things that bring you joy. They can help pull you out of that emotional sewer that comes when you're dealing with the ongoing and onslaught of the pain and managing it. It is, so arthritis doesn't only affect the physical body. We are one being, mind, body, and spirit. We're connected, and we treat the whole person. So next slide. I think I lost you guys again. Next slide.
We've got the next slide here, Tony.
Oh, okay. I'll just keep talking. So anyway, that was just a final. That was kind of it for me. Just some other information for me. And the main thing I think I want to focus on is just connecting. And I think Dr. Bowen again said this. When she was talking, we can't separate our physical from our emotional, relational, spiritual selves. We can't separate those. It's all inclusive and incorporated in us. So we want to address all of those areas. Again, arthritis is not just a physical pain. It can create pains in our emotions, our relations, and spiritually and financially as well. So thank you guys very much.